Thank you for joining us for this episode of Talking Health in the 406, where we are one community under the big sky. I'm your host, Maureen Ward, and I work to promote safe and healthy lifestyle choices to help Montanans prevent common life-altering injuries and illnesses. You may have recently seen or heard the letters HPAI in the news. That stands for Highly Pathogenic Avian Influenza, a virus that's been making headlines across the country and right here in Montana. Today, we're talking with Dr. Paul Ryan, a veterinarian, and Devon Cozart, an infectious disease epidemiologist, to help unpack what HPAI is, how it spreads, and why it matters to you. Whether you raise backyard chickens, attend your local county fair, or spend your weekends hunting waterfowl, this episode will give you the facts that you need to protect yourself, your family, and your community. So stay with us, because understanding HPAI isn't just about poultry. It's about keeping Montana healthy from the backyard to the backcountry. Well, hello. Thank you for being here today. We're excited to talk today about the highly pathogenic avian influenza, or the HPAI. I know it's been all over the news. And so today we have with us Dr. Paul Ryan and Devon Cozart to tell us a little bit more about the avian flu and what Montanans need to know. So we'll go ahead and start with if each of you could just do a brief introduction and tell us your role with avian flu.
Hi, my name is Devon Cozart, and I am the zoonotic and vector-borne disease epidemiologist with the state of Montana. So essentially, my role with avian flu and HPAI is some of the human monitoring aspects. So we're the ones who are keeping tabs on cases in animals and making sure we don't have transmission to humans, which is my primary role, as well as information distribution. So I'm the one responsible for putting out press releases, as well as writing what we call HONs, which are alerts that we send to our medical providers in the state if we have a major event that happens where we feel like our providers need to know what's going on so they can manage their patients.
I'm Paul Ryan. I'm a veterinarian, have been for nearly 10 years now. Generally, where your veterinarians fit into responding to any kind of avian influenza is noticing and seeing potentially the first outbreak of sick birds, where that might transfer over from wild birds into a population of a home flock, for instance, that people might call their family veterinarian and just say, hey, something's not quite right. And I am at DPHHS now as well, working on completing my master's in public health.
Great. Well, let's start with what is highly pathogenic avian influenza? It's so hard to even say. And how is it different from the seasonal flu or other forms of bird flu that we might have heard about?
So it's actually very similar in a way, but also very different compared to seasonal flu. And it is worth noting this is a flu virus, much like our seasonal flu. And we say, oh, I have a flu. It is the same virus, essentially. But what differentiates it is that it does not circulate seasonally in humans. So actually, the viruses that we understand as a seasonal flu started out at one point not being a seasonal flu. They started out as pandemics and became seasonal in humans. So that's one of the big differences. So we have our seasonal flus we're familiar with, and now we have what we call HPAI, or highly pathogenic avian influenza. And what this details is that this is an avian flu, meaning like a bird. So it's a type of flu virus that primarily transmits between birds. Flu viruses affect all sorts of different animals, birds, dogs, horses, bats. So it's a very adaptable virus. It's a very interesting virus. And the highly pathogenic comes into play, which I think can be a little bit confusing for people when they first hear it. Highly pathogenic avian flu refers to how the virus acts in domestic poultry. So highly pathogenic means that it heavily impacts, causes high mortality, high death rates in domestic flocks. So that's where the highly pathogenic comes into play. Again, referring only to the impact on poultry, not on humans. There's also a classification of these viruses called low pathogenic avian influenza, which doesn't cause us high mortality in birds, but sometimes can also infect humans and doesn't necessarily coordinate with how severe an infection in a human might be.
So let's talk a little bit about the disease itself. And, we live in Montana. So how long has it been circulating here and how did it get here?
It first showed up in Montana in 2022, and it's a disease that's spread by wild birds. It doesn't cause a very big reaction in many of the wild birds. There's a few species that are a little bit more sensitive to it. So occasionally, like the Fish, Wildlife and Parks, Department of Fish, Wildlife Parks here in Montana, they respond to sick birds or dead birds. Somebody will call and then let them know that there's some dead birds or a number of dead birds in a certain area, and they can go collect that. And that's where they can track that. For veterinarian domestic flocks of birds, usually we'll see a lot of sick birds pop up or a lot of dead birds all of a sudden. As Devon mentioned, it can get into a poultry barn or somebody's flock, and you can lose a good number of your birds overnight. It can act that quickly. So that's generally where we see it crossing over is from the wild birds into our domestic birds, and that's when oftentimes that's the first time that people, producers, families may notice that the disease is spreading.
Oh, I didn't know it acted that quickly. I myself have a backyard flock of chickens here in Helena, and we'll have to keep a lookout over the summer. Ooh.
Hmm. Yes.
So I know that in the news we have seen some snippets here and there of, there has been some human transmission and some other animals besides birds. So can you talk a little bit about it being found in other mammals? And then what is that likelihood of it, jumping to humans, and how concerned should Montanans be?
Um, Bottom line up front, I think it's important to say that it's very, very low risk for people to catch this, especially the general public. There have been a number of cases where people have become infected from both exposure to sick birds in a poultry barn and as well as sick cows. That is another place where it's spreading in animals other than birds. And those people were generally ones that were in a highly exposed environment, and they worked with those animals throughout the course of their workday, and they may not have had access or even known that the animals were sick, so they weren't protecting themselves appropriately. So the risk to the general public is very low. The reason why many veterinarians are very concerned is that because it can spread so rapidly and make huge numbers of birds very ill very quickly, that it can really cause problems for egg producers or poultry barns that produce meat. It can wipe out their entire operation in a matter of days if we're not keeping track of that. And it could spread rapidly from one producer to the other in a relatively dispersed geographic area. So we treat this very seriously as veterinarians.
How does it spread from animal to animal? Is it airborne? Do they have to ingest bodily fluids, or, you know, does it travel in poop? Like how do the birds spread it amongst themselves?
There's a lot of ways that it can spread for sure. It can be spread in just about any discharge. So, like respiratory droplets that might happen if a bird sneezes. That's something that you might not recognize is bird sneezing, but they do, and that can spread droplets of saliva that can carry the virus. Definitely can be shed in bird droppings. So it's one more reason to make sure you wash your hands anytime you're handling birds or cleaning up after cleaning up outside, just making sure you're protecting yourself. And it'll play into a lot of biosecurity measures that we'll talk about here in a bit. So, Devin, I think you've probably got a good things to add to this as well.
those are the primary methods we see with like animal to animal transmission. We're really worried about feces contamination, some droplet spread as well. So we refer to that kind of like as direct or indirect contact with the birds when it goes from bird to bird. So one big thing to watch out for example, again, we'll talk about this more when we get to biosecurity, would be waterfowl are the primary carriers. So do you have waterfowl pooping in areas where your domestic flocks are also hanging out? Is a big question to ask yourself. So that's going to be a lot of the spread that we're concerned with. In addition, sometimes with other mammals, what we saw early on with the HPAI spread throughout the US is we started seeing some other mammals get sick. And that was initially linked to carnivores and scavengers. Like if you look at the amount of mammals and the type of mammals we had getting sick, we were looking at raccoons, foxes, bears, mountain lions, really animals we associate with meat eaters or scavengers. And that's, we think, because they were consuming the bird carcasses themselves. And that's why they were likely getting sick with HPAI. That's changed a little bit since the start, but that's still the leading thought for why we were seeing that early infection in carnivores.
How does HPAI affect poultry farmers, egg production, and the wild bird populations here in Montana so far?
This is something that is highly variable. So far, we've been really effective at addressing when there have been outbreaks, and the outbreaks have generally been small and not spread much beyond the initial at all, beyond the place where it was first recognized. So the measures that the Montana Department of Livestock, the state veterinarian, and the USDA are taking are working very well to help prevent that from spreading further than, a small home flock that might be affected, or an individual producer of either eggs or meat. They're doing a really good job of shutting that down and making sure that it doesn't start spreading within a community.
Yeah, speaking of those backyard flocks, is what should people who do have chickens at home do to help protect their flocks? And if they do suspect, I mean, obviously it would be pretty obvious probably if they walk out and unfortunately many or all of their chickens have died overnight. What do they do? How do they report that?
Call your veterinarian as soon as you notice that your animals are unwell. And this can be when we're talking about the different ways that HPAI can show up in your home flock. It can be less severe, um, but it can also be all the way up to that very serious end where you walk into your coop in the morning and there's multiple birds that have passed away overnight. Some of the things that you might see in your birds on the very low end, perhaps the very first signs and symptoms that you might see, is that your birds might just be kind of ruffled. They'll be quiet and ruffled. Their feathers will be fluffed. They'll just not look very energetic. They won't have the same energy that they normally do. Those are kind of some things that might be cluing you into. Maybe I should call my veterinarian and let them know what's going on, and they can come out and see what's going on. Some other things that we can see would be swelling of the wattle, those soft kind of tissue portions around their beak and on their faces that can be swollen. It can change colors to like a blue or a purple or darken. And that can happen the same on their feet. So anywhere where you can see the skin, you can keep a close eye on that and see if there's some color changes or if there seems to be swelling. Those would be signs that I would be getting a little bit excited, and I'd want to call my veterinarian as soon as possible and see if they could come take care and see what's going on.
And is there anything they can do to help protect their home flocks?
There is. And when we talk about the term of biosecurity, it sounds like this big, complicated, scary thing. And it certainly can be for somebody that's like a commercial flock raiser, egg producer, meat producer. That's a very big part of what they do, and they invest a lot of money in it. But for most home family coops, there's a number of small things that you can do that, may decrease the risk that your birds are at substantially in just protecting them from coming in contact with some of the materials that could cause them to be ill. So the first thing that we can do is there's a ton of really good resources out there. The USDA has an entire program called Protect the Flock. And it has a ton of really good resources that if you're curious and interested, you can search for USDA Protect the Flock, and it's linked through the Centers for Disease Control, the CDC as well. But what that boils down to is, like Devon mentioned, this is a disease that's passed through from wild birds contacting your birds in some way, whether that's through pooping in areas where your birds are also have access to, whether they might be able to come in direct contact with them, particularly birds like waterfowl. Those are big risk factors, and there's a couple of things you can do if you have a small coop, is keeping your chickens and birds kind of collected up to some extent as much as possible, and then putting potentially like bird netting over the top of the coop area. That should stop direct contact in most cases, as long as it's well maintained, of wild birds getting into your coop area and potentially eating food that might have been left out in the hen and the yard area, that your birds also have access to. Now, it doesn't prevent wild birds from flying over and dropping poop into that yard, but it does decrease a lot of the direct risk. Devon, there are some other things that you can think of off the top of your head that might be helpful?
I think one of the big things to point out too is this is especially important to consider if you know you're in an area that's prone to waterfowl. So if you have a lake on your property, if you know that you're underneath a flyway at certain times of the year where waterfowl migrate, um, make sure, especially if we're in waterfowl season where we're going to have birds passing over, that you're taking some extra measures during those times of year, especially right now when we know we have HPAI circulating and it's a risk to your flock. So I think that's a big thing to consider is just timeliness, knowing where you are on migratory patterns, and if you do have any shared water sources, controlling that as best as possible. And again, USDA and their Defend the Flock program has some great resources on how to do that.
You mentioned the USDA, and so I'd like to talk a little bit more about that. What are agencies like the USDA or the CDC doing in coordination with agencies around the state to help address HPAI both on a national level and also here in Montana?
This is a great example of what we've come to call a One Health approach, right? So when we say One Health, we mean that we have animal health and human health partners working closely together to benefit the health of humans and animals at the same time, rather than trying to operate as separate entities, because really we're all connected, right? So we have this very strong One Health approach. USDA is working with the CDC. USDA is working with the FDA. USDA is helping on at state level and the federal level as well, which is very important to work out. They're all working with Fish, Wildlife, and Parks, and all of them are working with state and local health offices. So everybody's working together here, and everybody is involved. So a lot of this involves reporting, right? So on the human health side of things over here, like where I work for the Montana Department of Health, I would not necessarily know that we have an affected bird flock unless I am told, because that's not something that we normally monitor since we are human health focused. So how that usually works is our partners over at the Department of Livestock reaches out to us when we have a bird flock that's positive and alerts us to that positive. That way, on the human health side, we can step in and start talking to the flock owners and let them know what they're at risk for, give them a little bit more information about HPAI, and make sure they're not developing any symptoms of HPAI, so we can make sure that we're reducing the chances of transmission to humans and making sure that it's not actually going from the birds to the humans in the first place. So there's a lot of coordinated efforts here. This includes with wildlife parks as well, so with wild mammals and birds. It works the same way. We're notified, and then we step in and handle the human health side of things, while they manage the animal health side. So what to do with the infected bird flocks, or how to test a mountain lion if they think a mountain lion might have HPAI.
And of course, I think of diseases like influenza, and we do have some protective measures for sort of the normal strains of flu. Are there any vaccines or treatments available or being explored for HPAI?
That's a great question, and it varies a little bit with which we're talking about. So in terms of treatments, yes, we are very lucky in that the flu antivirals that we already use for our seasonal flus will still work on HPAI. Let's say that you have contact with your backyard flock ends up positive. After that positive is detected, we can go ahead and get you started on antivirals. Again, that's going through your primary care provider. I'm not going to prescribe that directly, but I can recommend that you talk to your primary and get some antivirals started if you would like them. So that's a really early way we have of managing our exposures to HPAI and making sure that we're not getting sick. And we're lucky that we already have these antivirals available and in mass quantities and ready to go because we're used to using them during the flu season. On the vaccine note, that's a little bit different. Our flu vaccines are made up of types of flu viruses that are our seasonal flus, right? And that's what it's supposed to protect against. We do not currently believe that's going to provide any cross protection with HPAI. And the reason for that really comes down to, again, the type of flu that we're looking at. HPAI and seasonal flu are both a type of flu A. So both within that same family of flu viruses. Break that down smaller, and our seasonal flus currently are referred to as H3N2 and H1N1. Our H1N1 having derived from our '09 swine flu pandemic, if anybody recalls that. In contrast, the current HPAI we have circulating is called H5N1. The differences in those two, we have an H3 and an H1 versus an H5, means that there is not a lot of cross protection because it's just too different of a flu virus, unfortunately. And because of that, what we do instead have developing is what the CDC does when they are tracking this virus is they have and are preparing based off the genetics of the virus that's currently circulating, that's H5N1 HPAI. They have a candidate vaccine virus ready to go. So they are tracking this virus, they are keeping track of any genetic changes, and they have a candidate vaccine virus ready in case this does start going from human to human and spreading really easily to humans. So while there is not one currently, it would not take us very long to get one rolled out if we needed it.
So it seems like the message is right now the transmission to humans is pretty low, and we're not seeing a lot of human to human transmission at this point. Is that correct?
That's right. So currently, we still are saying, and we still believe that the risk to humans is very low, especially to the general population. Again, if you're just walking to work, you're living your normal life, don't have a lot of exposure to animals, that kind of thing, you are at essentially no risk currently of HPAI. Um, we see some populations with a slightly elevated risk, and that's going to be our backyard flock owners who have contact with sick birds. And again, as we've mentioned, we are not talking about your flock is mostly healthy but acting a little bit off, or maybe you had one bird out of 50 die. We're not talking about that. We're talking about mass death within birds, and in some cases, confirm HPAI exposure. So we're worried about those individuals, people who collect and harvest waterfowl, who hunt waterfowl, veterinarians who possibly have exposure to HPAI through other livestock owners, such as dairy cattle owners, alpacas, that kind of thing, or people who handle raw milk. All those are going to be our elevated risk factors and more. But those are kind of our main categories. Again, that's just a slightly elevated risk. We're really not seeing a high impact in humans currently, or a very good adaptation of the H5N1 virus to humans. So it still doesn't like us very much, which is great. And as a result of that, we're still not seeing human-to-human transmission in this type of H5N1. But I like to warn that doesn't mean it's impossible. And that's part of the balance here. We've seen what we refer to as non-sustained human-to-human transmission of previous types of H5N1 viruses. So what's happening in the US right now is not the first time we've seen H5N1. There's been previous outbreaks in other countries around the world. And when we've seen that, there's been just a handful of documented cases where someone who was very sick, who may not have access to healthcare or does not seek healthcare, is being tended to primarily by a family member during their illness, and that family member develops HPAI infection. And then it stops there. It does not go any further than that one family member. And that's been in just a handful of documented cases. So it does happen, but it's still extremely poorly adapted, and we haven't seen that happen at all with the current type of H5N1 circulating in birds and other animals in the United States.
Yeah, and I can add on to that maybe some context on the animal health side of the house too. There are some vaccines that are currently in process for animals, particularly the most cases that we have seen spread from animals to people have come from dairy cows and from chickens. And currently, there are vaccines available for each respective species, but they haven't been approved for license for use by producers at this point. Preliminary studies have shown that they're effective in decreasing the amount of virus that might be produced, or when you get sick, the virus produces billions and trillions of itself inside of you. And generally, with these vaccines, we've seen that number vastly decrease. Um, the important thing there is that even though the animals get sick, they're not producing the levels of virus that could potentially jump over into people. And that's a huge protective factor. Um, and that's something that's being looked at very closely right now, because that would be one of the ways that we could really significantly decrease the risk of getting ill with HPAI, even for those people that have to live and work within very close proximity of animals that could get ill. So this is something that's interesting to keep an eye on in the future, but there's no current estimation of when those may become available or go into general use.
As far as our hunters go, what sort of recommendations, guidelines do you have for especially our waterfowl hunters, as to how they can also protect themselves as, they're out hunting waterfowl, cleaning waterfowl, and the things that they need to be thinking about this season?
One big note being that waterfowl won't always show symptoms of HPAI. So unlike when we're talking about other animals, in some cases, with waterfowl, we're not talking about an obviously sick bird in all cases. Sometimes they can show symptoms and be visibly sick, but sometimes they won't. So that's really important to note, especially when you're hunting and handling waterfowl, is that they may not show any obvious signs of illness. So what we typically recommend, and what we recommend anyways when hunting or harvesting anything, is PPE while we're doing that. So that's going to include like gloves, because we mentioned before they can have, if they have saliva like on their feathers from where they've ruffled their feathers with their beak and that kind of thing, that can have virus in it. As well as anytime you're handling feces, not to mention tissue and animal organs and that kind of thing. So gloves always big, especially monitor the status of your hands and make sure you don't have any open wounds on your hands while you're handling these things, because that's always a bad idea, because that's a really great entry point for HPAI as well as many other types of illnesses. Additionally, we do tend to recommend like a face mask, because as you're processing an animal, you can essentially kind of splatter liquid around. So face masks and goggles are always great, as well as once you get home, taking off those clothes and immediately throwing them into the wash and dryer. Because especially with avian flu, and if you have a backyard flock, what we can see is that the clothes that you wear when you're touching waterfowl or in their environment that you then bring home to your animals, to your family, will still have viable virus on it that can spread. So that is another way of bringing infection essentially back home to your animals or to your family members. So again, take off those clothes, go ahead and toss them in the washer and get those clean, is another great thing to do.
Hmm. And then for consuming wild game, it's important to make sure that you cook things to an appropriate temperature. The virus is not viable once it's been cooked. It cannot, as long as even if it's a duck that was ill with HPAI and didn't look ill. You did appropriate procedures to protect yourself during the cleaning process and the processing. As long as you cook that bird to the full temperature that's recommended by the USDA, that will be safe to consume for you and your family. As a veterinarian, I will say this, is I know it can be tempting sometimes to share some of the juicy bits with your your dog or potentially your cat when you're processing, withhold from that, please, because they can be protected as well by cooking that bird fully. If you want to share something with your pets, just make sure that what they're eating is fully cooked as well. That's important to protect them.
Well, it's almost summer in Montana, and we are coming up on county fair season. So I know my kids are in 4-H. We don't do the animal stuff, but they do love to walk through the barns and see all the animals, including chickens and cows. Is there anything for those fair goers or for the folks who are bringing animals to the fair that we need to know to stay safe?
I think the biggest thing is just communicating with your veterinarian ahead of time and letting them know that you're going to, if you're one of those families that's bringing your animals to the fair, this is something that's being tracked, and veterinarians are aware that we're getting into the fair season, that animals will be traveling around the state at higher rates than they do at other times of the year. And we'll have your veterinarian will have the best recommendation for how to protect yourselves and your animals that might be going to the flock. If you're families that just don't participate in 4-H, but you do like to go through those barns and just see all of the animals and the hard work that a lot of our families have been putting in around the state, that's wonderful and good. Just make sure we kind of follow the same recommendations as if you're hunting, is to, before you might go home and interact with your own birds or your own animals, just change out of those clothes and get them in the wash, make sure that they can't access that. And then the other thing that you can do too is just fairs will be putting up hand washing stations, hand sanitization stations, and please do follow any instructions that might be posted in those where they're in those barns and areas where they're keeping all the animals. Just follow the instructions really carefully, because those instructions have been developed with a lot of care and thought about how to protect the animals that are there, as well as animals across the state that may be at people's homes and just from visiting families. So there is a method to the madness. There's a lot of things going on, so just keep that in mind, please. And thank you.
Yeah, I can add on a little bit to that as well. Agricultural fairs are we're not only concerned about like HPAI there, right? That's going to be a bigger concern. Well, we know we have it circulating, yes. But in general, there's something that occasionally results from contact at agricultural fairs that we refer to as a flu variant, which means a new type of flu can pop up at agricultural fairs. And these may be mild cases and they may be severe. It really just depends on the virus itself and how you react to it. So again, proper hand washing is great at agricultural fairs, especially if you're going to go enjoy a snack afterwards. Make sure you're washing your hands before you put in that hand in your mouth or in your eyes. Or if you don't have access to soap and water regularly, which does happen at ag fairs, remember to at least have some hand sanitizer at ready, which will help. Um, that also comes into play with some GI-based illnesses such as salmonella, which can happen via contact at agricultural affairs. So hand washing is great. We're always here to promote some good old-fashioned water and soap on the hands.
Are there any myths out there that you've heard that you would want to dispel about avian flu?
I think a big one that I see quite often, your chickens at least, or your backyard turkeys, whatever flock you have in the back, are not going to have HPAI specifically and not show symptoms. That's a big measure for avian flu. Um, so this is not something that's going to cause sporadic illness in you while your birds are still healthy. And again, we're not seeing human-to-human transmission. So this is not something that's currently transmitting in the community. So any fear around that, we are not currently worried about that type of transmission. Our frontline people right now are going to be people who have hands-on contact with infected animals, especially dairy cattle and positive poultry. And that's really where a lot of our attention and our prevention measures need to be right now.
And I think something important to keep in mind too is that really the only two species that we have identified as being a risk for the avian influenza to spread from cows and chickens. Those are the only two species that we've identified really that can lead to human infection. Many other species of animals can become infected, and it can be quite serious for them. So we recommend that you always have your animals seen at a veterinarian, but it's not a major risk for you should your house cat become ill with avian influenza. We'll still recommend that you try and clean up as much as possible and be sanitary at home if your cat is found to have avian influenza, but don't panic is the big thing that we want to carry over with pretty much any animal exposure outside of chickens and cows. We don't panic even with the chickens and cows, but there's even less of a risk with any other animal that you might come in contact with. Just practicing good hand washing technique is really the best thing that you can do and will, in most cases, likely be very sufficient.
I can elaborate a little bit more too on some of the food safety side of things because I know there was quite a bit of alarm caused early on when we first started detecting HPAI in cattle, and refer to an investigation that showed positive milk samples in commercial dairy products, so like the milk you'll get at the grocery store. That is not um, a worry. Any commercially available dairy or poultry products are not a concern right now. The reason for that messaging that was distributed was because it is possible for some milk that was previously contaminated with a type of HPAI to still test positive after it has been pasteurized. And that's because there's tiny little, essentially pieces, like fragments of that virus still left. They are not dangerous. They are not viable, meaning it cannot cause any sort of infection, and it will not make you sick. Body will not recognize it. But it can still test positive on some types of tests that can detect fragments that small of virus. We know full and well pasteurization does kill this virus. Pasteurization is essentially a superheating and then cooling of a product, and the flu virus cannot survive that. So even if before it was pasteurized, milk was contaminated, it would survive that process. So there's no concern for commercial dairy production at this time. Very similar kind of concept with poultry. Birds that are sick with HPAI, again, that's a very dramatic event when birds are sick, are not used in human food products if HPAI is suspected or detected. Um, and in theory, if we did have contaminated meat, as soon as that's cooked, we are not concerned anymore. It would kill the virus. So again, while you're handling poultry, to be extra safe, make sure you're washing your hands after handling like a chicken breast for the evening for dinner. Any sort of poultry products. We want to make sure that we're still practicing good hand hygiene for a lot of reasons on that. So wash your hands after handling it and make sure it's cooked to a safe temperature.
Well, and I hope everyone is anyway, because,
Yeah.
Right,
salmonella and
exactly.
all the other things.
Yeah.
Is there anything else I'm missing? Any other takeaways that you want to make sure Montanans know about HPAI as we head into the summer months and then, of course, into the fall?
A big takeaway that I really have with HPAI, and the dangerousness, but also the not dangerousness of it, right? How it's both a threat and not a threat at the same time. It can make messaging very difficult on this type of disease. Um, but the takeaway with that is the more contact we have with HPAI, the more likely it is to become a problem. So what we want to do is avoid contact where possible for people who can with obviously sick backyard flocks, with waterfowl, with sick dairy cattle. And if we do have to be around any animals like that, that we are wearing PPE, because the more often we have contact with this virus, the more likely it is to adapt to humans. And that's where we have a problem. Once we see human-to-human transmission, we're in a place we don't want to be with this virus. We've had influenza pandemics throughout human history, and no one's ready for another pandemic. So my big takeaway is that it kind of comes down to you at this point, right? The more that we do not interact with the virus and the more distance we have between us and it, the less likely it is to become a problem.
Yep, that's huge. And then I think maybe just recognizing what times of the year because it is still seasonal to some extent. Just recognizing what times of the year we need to be extra vigilant around our contact with birds. And the spring and fall migrations are a huge one because that's when we see a lot of those wild birds moving through our area, particularly the waterfowl that could be spreading that to our domestic flocks, as well as coming into fair season and the any movement of animals is always something that can increase the risk for exposure to things. Coming back to what Devon says, is we're really just trying to minimize the exposure of what's going on. So, for folks in the rodeo world, that's a big thing. You've all heard about a number of diseases that veterinarians are concerned about crossing state borders. This is very much the same thing. So, the more that we can do ahead of time to prevent these diseases spreading regularly, the less trouble we will have trying to keep track of that down the road. So, just keep up and have a conversation with your veterinarian anytime you're moving, traveling with your animals, and that will generally make a big impact on the overall risk to everybody in Montana and across the United States.
Is there anywhere where you would recommend people to seek out information on whether or not transmission rates are going up or down or anything, if they want to keep an eye on this as we go through the summer and fall? Where's the best place that they should look?
The CDC actually has a great summary webpage for what's happening with HPAI right now. And I think that is a great resource if you just want to know, is there any more risk? Are we seeing more human cases? I just want a snapshot and a visual of what's going on. The CDC current situation summary. And if you just type in that to Google, CDC, HPAI, current situation, it'll be the first thing that comes up. And they have a little map of where we've had cases. They have what those cases are associated with. So like we have so many cases in California associated with dairy cattle exposure. They have that all ready to go on their website, as well as information about the current risks to the general public. So that is just a great catch-all page in terms of human health risk that you can find very easily and very reliable. They immediately update information on that webpage as soon as we have new cases.
And this is something that we can link in the footnotes of this podcast.
I think another big webpage, because a lot of questions that I get, even working with the Department of Health, is, well, have you seen any positive animals in the state? Or where have you seen positive animals? There's two different major resources for that. One catch-all for this information nationally is going to be the USDA again. So USDA HPAI detections, and they have it broken up for the whole country based off mammals, wild birds, domestic birds, and livestock, other livestock. So you can see where there have been recent detections around the country. So if you went to that and typed in Montana, you would see that when our last detections were throughout the states. In addition, our Department of Livestock has their own webpage about where we've had positive flocks in the state. So you can see, again, when our last positive flock was detected, where it was, and what our timeline looks like in terms of like, when was our highest amount of cases? How did we look in March of last year? So they have their own maps on the webpage showing all that information.
This is something that is not just being monitored by the US, but also by Canada, Mexico, and a lot of countries in South America. The whole world's keeping an eye on this. So it is something that is under a lot of vigilance right now. And there's a lot of really smart people keeping an eye on all aspects of it, particularly through the One Health lens, to make sure that we are doing everything possible to make sure that this doesn't become a big issue, as Devon mentioned, and become a human health issue and past just an animal health issue.
One more point here that I think is worth referencing, and that it can be a little bit difficult to discuss, but I do want to briefly mention the human flu vaccine. And you might remember that I already said that it's not protective against HPAI, right? But if you're somebody who has constant contact with dairy cattle that might be infected, or domestic poultry that might be infected, we highly encourage that you get your seasonal flu vaccine. And the reason for that is actually because I've also mentioned how the more contact we have with this virus, the more likely it is to be able to spread and infect humans. What makes that situation all the more likely is if you have human seasonal flu and you decide it doesn't matter that I'm sick right now because my cows need to be fed. That is a priority for you. However, if we start having contact between human flus and HPAI, those two flu viruses can actually combine, right? So we want to avoid that wherever possible. The less likely you are to be sick with seasonal human flu, the less likely we are to see the HPAI virus mutate in a way that is going to be dangerous to us because we don't want those two flu viruses meeting together.
I'll echo on Devon there. That's one of the most common ways that we see a rapid shift in flu viruses because they kind of fit together like puzzle pieces, I guess is the best way to put it. And when you've mixed together two different puzzle boxes into the same person or pig or um, some other farm animal, take your pick, and they have two different influenza viruses at the same time, the risk is that those puzzle pieces will get jumbled, and then suddenly the part of the puzzle piece that makes it really be able to spread between chickens or people gets put onto something that was originally in a pig, and then that's how we can see a rapid shift that can be very, very troublesome for us as people.
Well, thank you both for joining us today. I appreciate your time, and hopefully we can have a great summer and fall here in Montana and keep HPAI out of the human population as much as possible. So thank you for all of your great knowledge.
Thank
Yeah,
you.
thank you so much. I'm happy to be here.
Thanks for listening to Talking Health in the 406, where we are one community under the big sky. I'm your host, Maureen Ward. A big thank you to our guests today, Dr. Paul Ryan and Devon Cozart, for sharing their expertise. If you'd like to learn more about highly pathogenic avian influenza or any of the topics we covered, please visit talkinghealthin406.mt.gov. If you found this episode helpful, please rate, review, and subscribe. It helps us reach more Montanans like you. Until next time, take care of yourselves, your neighbors, and your flocks, and stay healthy, Montana.